Hope your work week is off to a good start. I'm Min Sun-hee. For the first time in some 50 days, Korea's daily tally has dropped to the 300 level. And hoping to bring that figure down further, authorities have decided to extend the social distancing guidelines they had in place, as well as the restriction on social gatherings until the 31st of this month. I have Kwon Soo-ah standing by with more on this and the other measures. So let's begin then with the numbers for Korea for this Monday.
Yes, Sunny. Korea posted the lowest number of COVID-19 infections since late November. And which means the numbers have dropped to the 300s this Monday. 366 domestic transmissions and 23 imported cases to be exact. And that brings the total here in the nation to 72,729, while the death toll stands at 1,264 with 15 new fatalities. Now, although a lower number of weekend screenings has to be considered on Mondays, even if we compare the number to last Monday, we are seeing a significant improvement.
Right, and despite that, like I mentioned earlier, authorities have decided to extend the current social distancing guidelines for the time being.
That's correct, Sunny. Level 2.5 social distancing measures, which is the second highest of the 5-tier scale, will be mandated in the metropolitan region and level 2 elsewhere for 2 more weeks. And also the ban on private gatherings of 5 or more people remains in effect as authorities assess those as having had effects in recent prevention efforts. But what's changed beginning this Monday is some relaxed rules at a number of facilities. Drinking and eating at coffee shops will be permitted until 9 p.m. and indoor sports facilities, singing rooms and cram schools can operate again, however, under strict guidelines on social distancing within those facilities. In-person religious services will be allowed at up to 10% capacity in the metropolitan region and 20% elsewhere. And the government is aiming for another clearer drop in the numbers as small and bigger outbreaks remain across the nation. In fact, at least 2 cases were reported this Monday in all of these 17 provinces or major regions in the country. And the virus, meanwhile, was also one of the hot topics at President Moon Jae-in's New Year's press conference this Monday. President Moon predicted herd immunity to be possible at around September, saying faster than in many other countries once vaccination kicks off next month here in the country. Now, speaking of vaccination, the states in the U.S. and EU countries are apparently running out of vaccine doses, and there is also higher concerns regarding the safety of vaccines as 29 Norwegians reported dead after receiving Pfizer vaccines. However, vaccination process is continuing across the nation, which is needed at this point. For instance, in Brazil, with almost 8.5 million cases here, this is a country that has just started its vaccination program. In the meantime, cases have been rising in the UK and South Africa due to the variant there over the weekend, with South Africa having surpassed the total number of Iran over the weekend. And the total number of cases around the world stands at almost 95.5 million. And those are the updates I have for now, but I'll be back in a bit after the government briefing.
All right, so thank you for now. Staying on the international front, Israel is reportedly leading the world in vaccinating its people. And to learn more about the success, I have Sami Sokol live on the line. Welcome, Sami.
Good morning.
Now, before we delve into the active rollout of COVID-19 vaccines in Israel, Sami, do tell us a bit about the COVID-19 situation there amid a third lockdown, I believe.
Yes, indeed. We have here a third lockdown. The lockdown was supposed to be until January 21st, but officials here in the Ministry of Health are demanding yet another week of lockdown because the situation here in Israel seems to be quite dire. I can tell you that we have currently 81,000 cases of COVID, and out of these cases, we're talking about 1,177 serious cases of COVID-19. And maybe what is more alarming, so far in Israel, a country of 9 million, there have been 4,005 cases of death 1,000 of them only in the last month. So we've seen here a surge in cases, and I can tell you that we have a full lockdown, but there are parts of the Israeli public that are not following the lockdown instructions. Especially we're talking about the ultra-Orthodox, very religious communities where some of their schools are still opening in these days now.
I see. Sami, meanwhile, on a more slightly optimistic note, more than 20% of the 9 million population that you mentioned have received the first dose of the vaccine as of last week. Do fill us in on the campaign, on the vaccination campaign there.
Yes, indeed. Actually, the campaign has been very successful, and I can give you the latest figures that we have here. We've had a 2,100,000 cases, people who have been vaccinated so far. That means 23% of the population has already been vaccinated for the first dose. And on top of that, already 290,000 people have been vaccinated for the second dose. So this has been a campaign began here on the 19th of December with Prime Minister Benjamin Netanyahu, whom you see on the screen. He got the first dose on the 19th of December. And since then, we've had all the medical staff here. They've been giving vaccinations to those who are over 60 and later on those who are over 50. Currently, anyone in Israel who's over 45 can be vaccinated, including the teachers. And but I can also say at the same time that 25% of those who are over 60 have not been vaccinated.
I see. Sami, what has been disclosed thus far with regard to the side effects of the vaccinations?
Well, I can tell you the most common side effect is a pain in the shoulder where you get the vaccine itself. I can witness, I was vaccinated myself, and the pain actually continued for 2-3 days. So this is something that in some poll that was conducted, some 70 or 80% have said that they've suffered such pain. On top of that, we know that about 45% they suffer from weakness. Another 20% say that they have suffered from fever. Another 10% have complained that they have fever. So these are like the main side effects that we've seen here.
So, Sami, what do you suppose is the secret behind Israel's successful inoculation campaign thus far?
Yes, well, I think the main thing is that, first of all, we have a relatively small country, so it's been easy to roll things out. There's a good system of health maintenance organizations, HMOs. Here in Israel, they're called Kupat Cholim, that's the Hebrew term. And all the population here is a member of one of the 4 different HMOs. Both citizens, residents throughout the country. So everyone is already registered in one of these HMOs. And the Minister of Health, they supplied the HMOs with these vaccines. And you have these HMOs in each town, village, neighborhood throughout the country. In the big centers, here, let's say in Jerusalem, there's a center where you had a big sports arena. They've been working 14 hours a day. And,
That's quite remarkable. Sami, I'll have to interrupt us right now because the briefing for the COVID-19 situation in Korea has started. But thank you very much for making the time to join us live at this hour with your thoughts.
Thank you. Thank you, Sunny.
The total caseload now stands at 71,820. Currently, we have 12,742 people remaining in quarantine, and there are 343 patients with severe or critical conditions. We had 15 additional fatalities, raising the death toll to 1,264. The fatality rate now stands at 1.74%. I extend my deepest condolences to the deceased and the members. of the bereaved families. And as of January 18th, let us now look at the updates on our new local infections. We have 366 new local infections, and about 66.7% or 244 have been reported in the metropolitan area, and the rest 122 in the non-metropolitan area. For the past week, we have seen 491 cases nationwide, which is below the 500 mark. And aside from Gyeongnam province, we are seeing a steady decline in all of the provinces and regions. So as for the details, please refer to the press kit. And during the past week, we would like to go over some updates on our quarantine response. And until the 16th of January, our average domestic tally for daily stood at about 516, which is about 30.1 cases lower than the previous week. And we have reached the peak on the 15th, and we are seeing a steady decline for the third straight week. And also imported cases, we have about 29 cases, which is below the 30 threshold as well. And by also regions in Gyeongnam, aside from Gyeongnam, all of the regions, we have seen a steady decline in all of the domestic cases. And during the past week, as for the sources of infection, we have seen that most of the cases were related to the contact with previously confirmed cases, about 45%. And also we have seen that at hospitals or nursing homes, we have about 8.1%. And we have about 5.5% imported cases, and also 940 cases, or about 20%, under investigation. And looking at the sources of infection during the past 4 weeks, we have seen that the contact with previously confirmed cases also stood at some 34% during the last week of December. However, it increased to about 45% in the first week of January. And also, we have seen 12% of the cases stemming from nursing hospitals in the December. However, we have seen this figure drop to about 8%. And also, we had about 3.9% of imported cases, and our figure, the proportion, however, increased slightly by around 5.5% during this early this month. And also we have seen a similar proportion of people who are under investigation. And as for the number of new cluster infections last week, we have 14 additional cluster infections, and 5, accounting for the majority of them, were family-related transmissions, and 2 religious facilities, and 2 also nursing hospitals, and 2 education center, and also 1 in the military as well. And we are seeing those over the age of 60 account for a majority of those who have severe symptoms. And also we have high fatality rate among those between the age of 70 and 80. So we believe that the fatality will also climb going forward. And we had about 136 cases of fatality during the past week. And 76 or about 50% of them were aged over the 80. And also we had about 27% or 39 cases in their 70s, and also 131, about 96% of them were in their 60s as well. And most of them also had infections at nursing hospitals, about 56%. And we have seen that 16.2% were contacts with their family members. And also we have some other other contact cases going under investigation. And as for the domestic COVID-19 tally, we are seeing a steady decline for the past month or so. However, we still have many risks of infection. And as for the risk factors, here are as follows. First of all, we have hidden spreaders and also many risks that could spread the virus through our daily routines. And we have seen that 45% of the contacts, the confirmed cases were contact with previously confirmed cases, meaning that the virus can spread at any place among any people. And we are seeing a high cluster infections stemming around family members and relatives as well. And we have over 20% of the cases which are under investigation, meaning that we have many silent spreaders. And the quarantine authorities has decided to extend the operating hours and extend the operation of the makeshift testing centers. And if you are suspicious of COVID-19 or if you have any contacts or have any COVID-19 cases within your family, please visit these screening centers as soon as possible to get tested for the virus. Moreover, we are having a continued ban on any private gatherings of 5 or more people. And please ventilate your space on a regular basis and disinfect frequently touched areas. And second, there are still continued cluster infections stemming from virus of vulnerable facility. For instance, the BTJ Missionary Center in Sangju and also in Gyeongnam Province, Jinju City, we have the prayer house as well. And as for the nursing homes and nursing houses, we are carrying out preemptive massive testings, and the testing shows that some cases have been identified at an early stage. So if we are unable to identify such patients at an early pace, we believe that it is very difficult for us to isolate this confirmed case, which could trigger a massive outbreak. And the quarantine authorities would like to note that any visitors who have went to the BTJ Missionary Center, they need to get tested. And we are currently having an issuance of the administrative order to test all of them. And we are carrying out strict quarantine measures. And especially for the visitors who have been going to the BTJ Missionary Center but who have not yet get tested, we ask you to get tested as soon as possible. And the same goes for those who have visited the prayer house at Jinju City. And third, we also have the variable, which is the seasonal winter weather. And as we see an ease of the social distancing measures to some extent, we are having a resumption of private and public venues. And also in the Lunar New Year holiday, we could have also the high contacts among people. And in the metropolitan area, as for the public facilities, we have been put in place an attendance cap and also an operation ban after 9 p.m. and also wearing a face mask at all times and prevention of eating and consuming food. And also at face-to-face services at religious facility, you need to wear face mask, and also the attendance cap is capped for 10% at the metropolitan area and 20% in non-metropolitan areas. And we are still bothering all group meetings within religious facilities, including prayer meetings, choir meetings, as well as Bible studies. So we ask you to comply with these measures on a stringent basis. And during the Lunar New Year holiday, please refrain from visiting your elderly as well as parents and relatives. And instead of visiting them in person, please stay in respective homes and also contact them remotely. Next, we also have some updates on the characters of the COVID-19 new variant. Recently, we have been witnessing the new variant of COVID-19 stemming from UK, South Africa, and Brazil. And aside from these countries, we are seeing other new variants as well. So starting from these three viruses, we see that the origin of these three variants are different. However, the amino acid of these virus variants have the commonality in that there is a change, a mutation of 501 number amino acid. And as for the South African variant, we have specified that they have high transmissibility. And as for that stemming from Brazil, we are under investigation. However, we suspect that it is also highly transmissible. And as for the impact of these new variants on the vaccines, we are continuously carrying carrying out analysis and assessment. So the quarantine authorities would like to go into detailed analysis for the genetic sequences of these new variants. And we have been complying some about 200 samples from these variants, from these virus samples. And we have seen that in November and December, we carried about 500 samples. All of them were GH strains. And after May, since May, we have seen that the dominant case here in South Korea is the GH strain. And aside from that, we did not spot any new variant stemming from South Korea. However, we have seen 5 reported cases of the new variant here in Korea, which were the contact with the previously confirmed imported cases. And we also conducted about 500 sample testings for imported cases, most of them coming from UK, South Africa, and Brazil. And we have been conducting the analysis for the confirmed cases as well as contacts. And we also seen a total of 18 new variants being reported here in South Korea, and 28 others did not have the new variant, and 12 others are under investigation. And starting from December, the quarantine authorities would like to note that we are intensifying our quarantine measures in our borders to stem and to prevent the influx of the new variant. And we are also conducting continued monitoring of these countries that have been reporting these new variants. And all of the foreign entrants are mandated to present their PCR negative documents upon entry. And also before they are released from self-quarantine, all of them are subject to another round of PCR testing. And starting from today, all of the foreign entrants, they are also mandated to get tested within 1 day of entry, which is shortened by the mandatory 3 days. And we have some exemptions on people who have been coming into Korea and arriving in Korea in midnight and late hours of the night. And we are also conducting continued analysis of these genetic sequencing as well. And as for the influenza virus, we are seeing a below our annual average level. And as for the COVID-19 vaccines, here are some updates as well. We are preparing the COVID-19 vaccination here in South Korea, and centering around the task force, we are continuously preparing ourselves to prepare for the inoculation plan. And we have launched a pan-government committee, and we have carried out the first round of a meeting, and we have also identified some detailed tasks as well. And as for the process of the vaccines and as for the approval, we have the Ministry of Food and Drug Safety monitoring and supervising this area. And as for the import of these vaccines, we have the TF team set up at the Transport Ministry. And as for the retail, the Ministry of Defense is carrying out the retail as well as delivery of the vaccines here in South Korea domestically. And the administration and the Safety Ministry has the TF team to run the safetiness of the administration. And we will make sure that we will be cooperating closely with the Safety Ministry to prepare for our possible inoculation plan. And as for the people who are needed, the personnel who needed at these inoculation centers, we are cooperating closely with the local governments as well as the medical circles. And in order to ensure a safe inoculation environment, we will be carrying out training sessions as well. And to provide you with the latest information on vaccine, we are having a revamp of our system, and this will be notified to the public starting from February. And under this system, people can get notified of their necessary vaccination time and target and timeline. And we also have the issuance of the documents as well. And starting from last week, we have carried out the first round of committee meetings with the Association for Nurses and Doctors here in South Korea. And we also are going to carry out cooperation on the training and education of these medical professionals. And we will be having our full-fledged discussions going forward. The number of COVID-19, as of today here in South Korea, we have about 419 cases, and our reproduction rate decreased to about 0.79%. And we are seeing a major decline in the domestic tallies in all regions aside from Gyeongnam province, and this was possible thanks to your support and also the endurances of the small business owners as well. And our COVID-19 outbreak has peaked with about 1,000 cases. However, we are seeing a slow downturn. We believe that we cannot stay complacent as of yet. Starting from today, we have the resumption of operations at major public facilities, and we will be resuming on physical services at the religious centers as well. However, this does not mean that we can stay complacent to a large extent. We still have many risks of infection. However, as we have said earlier, we are adjusting these measures because of the difficulties in the livelihoods of the many people. We still have many risks at hand, and there are many risks of local transmissions. So we continue to ban any private gatherings of 5 or more people. And also the public facilities and nursing and also the religious facilities. We ask you to comply stringently with the quarantine guidelines, including an attendance cap and also the operation hours. And we need to continue on with our downturn of the COVID-19 cases in order to protect many people and our daily routines. Please also comply with the quarantine measures wherever you are. And also the quarantine authorities will also make sure that we can contain the third wave completely. Thank you very much.
Right, that was Monday's afternoon briefing on COVID-19. Now, we do apologize for the abrupt end in our connection with Sammy over in Israel, during which we had been talking about Israel's global lead in the vaccination rate per capita. Right, Soa, now do give us a summary of Commissioner Chung Kyung's briefing for this Monday.
Well, let's start with the average of domestic infections in the past week. This up until January 16th, the 7-day span. 516 is the number we're seeing, which is down by around 30% from the previous week. And also the reproduction rate of the virus stands at 0.7% right now. So that is good news. But still, around 45% of infections are occurring from contact with previously infected people. And this is also why one of the reasons why the government has decided to extend the temporary screening center operations for 4 more weeks. Tong also had some updates on the COVID-19 variant from abroad. There are currently 15 cases from the UK, 2 from South Africa, and 1 case from Brazil.
I see. All right, Soa, thank you for that. I'll see you again tomorrow.
See you tomorrow.
Korea's first case of COVID-19 was reported on the 20th of January. Now, it's been about a year since then, and in this next report, we shed light on the stories of service and sharing amid the ongoing fight. To take a look.
2020 will be remembered as the year of COVID-19 and humanity's struggle to find some light amid the growing darkness. The sacrifice and dedication of frontline medical workers played an important role in giving us the strength to carry on.
24시간이고 48시간이고 계속 근무를 하시면서 환자분을 케어하시다가 쓰러지시고 호흡과 영양제를 맞고 다시 일어나서 환자를 보시고.
저희가 방호복을 입고 있어도 손끝이랑 발끝이 진짜 너무 시렸거든요. 특히 손은 이제 계속 손소독제를 사용해서 손을 씻기 때문에 그럴 때마다 진짜 더 추워가지고 일단 추위가 제일 힘든 것 같습니다.
How did these workers keep themselves going over the past year?
코로나 때문에 지금 전 국민이 다 지금 힘든 상황이고 그렇기 때문에 이제 저희들도 똑같이 동참하는 거죠.
Contact tracers also work day and night in their determination to save lives.
8, 9시간이 있었던 적은 있었던 것 같고 제일 기억에 남는 거는 새벽 1시 반에 퇴근했던 거. 그때 제 기억에 한 건이었거든요. 근데 이때처럼 뭔가 세계가 잡혀있지 않았었고
의료인과 역학조사관을 포함한 지자체 공무원들도 번아웃될 정도로 힘든 상황에 있습니다.
Even physical exhaustion was no obstacle, as they remained vigilant for more than a year to fight the pandemic. For its part, the government has vowed to roll out supportive measures aimed at improving their working conditions. Korea also demonstrated great civic awareness amid the pandemic, with the public eagerly complying with the government's preventive guidelines. Citizens also started many campaigns to help their less fortunate neighbors who had been hit hardest by the pandemic. Some landlords even cut their rent to help struggling tenants, many of whom are small business owners.
우리 상인들하고 같이 살아야 된다. 같이 산다는 것은 그들의 어려운 부분, 가려운 부분을 가려서 잘 챙겨주는 것이 건물주의 입장이고 임대인의 입장이 아닌가 생각합니다.
The country has come far with the help of charity and compassion, but many challenges still remain. One of these is the stigma and discrimination that have victimized many COVID-19 survivors.
출근을 하면 휴가를 가겠다라고 말씀하시는 분들이 있을 정도로 걱정을 심각하게 하셨기 때문에 너 걸렸던 사람이니까 내 주변에 있으니까 무섭다. 주변에 있지 말아라. 마스크 똑바로 써라.
It's just they try to give me hard times, like making a joke on me, kind of like, are you sure that you feel recovered? I know it's a joke, but during 2 weeks, I already had enough stress out. Those things all the time gonna give us mental after effect.
For those who've recovered from COVID-19, their fight is far from over, and we must do our part to lift the social stigma and sense of shame that have victimized so many of these survivors.
The first case.
South Korea also saw one confirmed case.
이런 접종의 시기라든지 그다음에 집단 면역의 형성 시기 이런 면에서 다른 나라들하고 비교해 보면 한국은 결코 늦지 않고 오히려 더 빠를 거라고 생각을 합니다.
Going into a second year of this could even be tougher, given the transmission dynamics and surrounding issues that we're seeing.
Korea's daily tally has fallen to the 300 level for the first time in roughly 2 months. Now, this fairly favorable finding comes as preparations are underway to launch public vaccinations next month amid hopes for a homegrown antibody treatment that seeks to keep mild COVID-19 symptoms from becoming grave. Now, for more on this, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And I also have Dr. David Kwak from Suncheon University Hospital. Dr. Kwak, thank you for being with us.
Thank you for having me.
Dr. Kim, earlier this morning, as seen in the video, President Moon Jae-in, during his press conference for the year, claimed that Korea's vaccination campaign is on track and has not been delayed when compared to those of its counterparts. Do you share his thoughts?
Yeah, I completely agree with him. And then, well, I actually did not just compare just side by side, just a Korean government and then some other foreign governments. But I think our government is not obviously not the slow in this the vaccination just preparation. And then, but based on the other experiences from the other foreign countries, we have to actually just consider some other the issues. For example, like logistics issues. For example, like some cold chains, especially for the Pfizer's mRNA-based vaccine, and also some vaccine compliance, and then some priority issues. We'll have to prepared very well just before just the vaccination starts. And we actually get some lessons from the foreign countries' experiences as well.
Right, because we are keeping our eyes open. Sure. Dr. Kwak, in response to side effects of vaccines, President Moon has spoken of government compensation for any severe side effect that has not been included in the common symptoms list. What are your thoughts about this intention?
Well, I applaud his intentions, and I also sense that he wants to reassure to the citizens of our country that it is the right thing to go get vaccinated once it's become available. Since 1995, our country has a system that on a national level that compensates for people who go through certain severe side effects from possibilities being from vaccinations. And continuously or so, they have been compensating rather not just very little numbers every year since 1995. I've seen numbers go up to hundreds of numbers in certain years. So I think we are going to rely on that particular system when President Moon mentions that we have a compensation system ready for those who might go through side effects. If I am allowed to make comparisons to other countries, to my knowledge, the US also has a very similar system on a national level that they have a compensation committee which makes rulings on which people to compensate for their side effects experiences. But under these systems, it's rather very hard for one single person to actually be allowed the compensation because they have many different steps that even within the committee that single person has to go through in order to achieve that level of compensation. So I think it'll differ for different countries, and also to my knowledge, India is now making the company to compensate for the people going through side effects. So I think many different countries are having different backup systems to assure people that they will be in the safe place when they go through these vaccination processes. So in our case, I think we are much better prepared in the sense that we have a very formal system that has been going on since '95. So I think it's now being the time that once the vaccinations become available, it's just us in line to go get the vaccinated.
Right. Dr. Kwak, according to the latest reports, at least 33 people in Norway passed away after receiving Pfizer's vaccines. What are your thoughts on this unfortunate reality?
Right. That's also something that has to be more deeply studied about. To my knowledge, I think the news are reporting that the majority of the people who are unfortunately has passed away are above 85 years of age, and they've also had very severe underlying diseases. We've had an experience just not too many months ago in Korea that more than hundreds of people have died timely after their shot of vaccinations. But we have to consider the fact that people who are either severely affected by certain underlying diseases or people who are already very old in their ages have much more vulnerability to be affected by not just the vaccinations, but from many other aspects of disease entities. So that has to be number one considered. Number two, these vaccinations create an atmosphere, what's called a pro-inflammatory situation, meaning a person would not die directly from the vaccination, but can be created a certain situation that they can be more prone to becoming more weak and becoming more weak to other environmental factors and diseases. So in that sense, I think we need to also learn from what's happened in Norway and take extra care when we are about to inject these vaccinations to, let's say, much older people or to people who are more severely affected by underlying diseases.
Right. Dr. Kim, aside from the 56 million doses from AstraZeneca, Moderna, Pfizer and Janssen, authorities here are also looking to secure an additional 10 million more from Novavax. What can you tell us about the vaccine by Novavax?
Well, the Novavax is a different type of just vaccine. The previous vaccines that you talked about is based on some mRNA-based vaccine or some virus vector vaccine. So basically, those systems, those new just platforms, somehow just some genetic information for viral spike protein, which acts as some immunogen or antigen, is actually delivered by RNA form or like the DNA form in the case of a virus vector vaccine. But the Novavax is basically just a subunit vaccine, which is a subunit means in this case a fragment of the virus, specifically just a viral spike protein. So this is more like some traditional just a platform for vaccine development. So in terms of sort of just a safety, I think maybe Novavax vaccine maybe just maybe better. But I think I do not just just ignore any safety profile of the prior ones. But this is one of the very traditional just method of just vaccine development.
I see. Meanwhile, Dr. Kim, how does the presence of such a wide selection of vaccines look to affect COVID-19 containment efforts?
Well, actually, in the beginning, government and our scientists actually do not know exactly which type of vaccine just might work just against the COVID-19. So this is very unprecedented, just the R&D, just the situation, especially for drug development and then the vaccine developments. So nobody knows which one would work. So it would be very safe to secure all different types of vaccine, just in case.
I see. Yeah. Dr. Kim, on the treatment front, Korea's Celltrion is awaiting conditional approval. How effective is its antibody treatment?
Well, based on the some recent presentation, they claim that maybe the efficacy is maybe better or just comparable than the very similar monoclonal antibodies developed by the Regeneron and the Eli Lilly. But actually, it is not really easy to just compare side by side unless we do just some clinical trials at the same time. So it is not for sure. But some professionals actually some concerned about some statistical significance of the some efficacy of the Celltrion just monoclonal antibodies, and there's some concern and also maybe some probably due to the some small number of some participants. So I think Celltrion would eventually just try some phase 2 clinical trial. That is also the one of the mandate condition for the conditional approval by the Korean FDA. So anyway, this is I think this is a sort of just a great achievement in this current COVID-19 pandemic situation, because at least the development is just the third. We just, it's like a joke, like some bronze medal in this case. Like the first one was actually a gold, and then silver medal was won by the Eli Lilly and the Regeneron, by now just Korean companies. Somehow they just achieved this just great accomplishment.
Right, so it's quite remarkable then.
Right, exactly.
Dr. Kwak, tell us a bit more about the patients who are likely to receive Celltrion's antibody treatment.
So it's not just particularly for Celltrion's antibody treatments. It goes for like all kinds of antibody monoclonal treatments, really. It's that it's indicated for people having very mild and in the beginning phase of the progress of the disease. It's mainly targeted at blocking the disease from progressing further to more severe illness. So for Celltrion's case, I think if it's implemented in the real world, I think it's going to be better used in patients who are with underlying diseases or much elderly in their cases when they're admitted, rather than compared to when they're much progressed in the disease. But that being said, I think that's also one of the concerns that we should have as a clinical doctors, because as Dr. Kim said, the treatment modality has only been studied through, let's say, 300 or a little more people. And we have to, based on the result from that study, to start implementing in a real clinical world, meaning we're going to have make our own decisions whether or not to use this particular invasive treatment modality to a person who has not progressed in the disease yet. So if, let's say, an 80-year-old patient comes in, being freshly admitted, is diagnosed but not showing any symptoms, we have to make the personal decision whether or not to use this invasive method for that person to further block the possibility of progressing through the disease. So I think it'll depend on the medical sector at this point, how much of an effect and how much of realistic effect we're going to have from Celltrion's monoclonal antibodies.
Quite a big burden on the medical staff then.
Well, at this moment, but further when we go into it, for more people we have from the studies or maybe from other studies, we'll be better able to base on those study results and start implementing.
I see. Going back to the idea of vaccines, Dr. Kim, when are we likely to see a domestic vaccine?
Well, compared to the drug development, the treatment, the vaccine development is relatively delayed. But I think at the moment, there's several companies actually trying the vaccine development, and then most of them are currently at the phase 1 or phase 2A clinical trials. And I guess probably under this current COVID-19 pandemic, it's probably we probably cannot use this domestic vaccine that we are actually trying to develop, but probably we will use the vaccine developed from some foreign countries at this moment. But I think the development of our own vaccine is very important because this COVID-19 and the other maybe some coronavirus disease has a high chance of just being endemic. And then maybe like just a flu, that we might just need some repeated vaccination, maybe just seasonally, annually. So in this case, somehow we need our own vaccine as well. So yeah, it's like just a flu case.
Right.
Yeah.
Dr. Kwak, what efforts then are needed to ensure an ideal environment for a productive vaccination campaign that we hope will start next month?
Well, obviously it will involve the logistical matter and also the medical environment. Both sectors have to come into the perfect place in order to give the safest vaccinations to everybody. Obviously, we would have to make sure the cold chain has been secured and we would deliver all these vaccinations to the right places in a rightly method. Also, as KDCA Director Jung Eun-kyung mentioned today, all the medical personnel that would inject these vaccinations would have to be trained so that they would carry this out in a very righteous manner. So I think both the medical sector and the logistical sector, the government in its triad has to come into the perfect triangle to carry this out perfectly as well.
Right, and hopefully that will be the case.
I hope
Okay, so. Dr. Kwak, as always, thank you very much for your thoughts.
Thank you.
And Dr. Kim, thank you for your insights.
Thank you.
Right, now, until safe vaccines are widely available, face masks and social distancing remain our best option of keeping the virus at bay. So do take care. See you tomorrow.